Good morning, afternoon, evening, whatever it is. All right, wherever you are, welcome. Our Philippine journey, Mike and Arlen, here from Angeles City, Philippines. It's currently 4 o'clock in the morning, and I'm making this video, I guess, for the second time. I didn't like the way the first one actually turned out. Um, the Philippines is currently in and facing an even larger crisis in a shortage of nurses. And that is so strange for a nation that was one of the biggest exporter of human lives as nurses in the world. Let's talk about that and how it affects possibly you.
Why'd you have to go? I guess this world's too slow for you. I think there's beauty in the gray, the cold, but you just want the gold. And there's no way I can beat it, cause I got no chance, no chance when it comes to her. She got the glitter and the fame, and I just wasn't enough.
Okay, so I came across this story the other day and I started thinking about it. And as a healthcare professional, it really rang out to me. And when I started to think about how to lay it up in layman's terms, how does it affect people? How does it affect not just expats, but even the local population? So here is the article. There we go. All right. So Quezon City 4th District Rep Marvin Rillo says there's no assurance that the latest batch of nurses in the Philippines will practice their profession in the country, if at all. Now, we're talking about registered nurses. We're talking about nurses that have to pass the same exams. I mean, they have their own boards here in the Philippines, but to be really qualified, they have to pass the same national registry that nurses in the US pass across the world, the NCLEX. All right. So, with that being said, they go through 4 years of education, pharmacology, patient, all kinds of different subjects. These are not just run of the mill type exams. These are not, this is actually a pretty intensive study course. We've known many nurses and what they've gone through here to become a nurse. And it's not an easy thing. But why wouldn't they be practicing, number one? And then as we explore a little further, we're going to find out that it's not just that they're not practicing, they're not doing it. So the Quezon City 4th District says, Marvin Rio says that there's no assurance. All right, fine. We went over that. Largely due to pressure to survive. Some of them will likely try to seek immediate employment, even if it means taking on other jobs, not practicing nursing. Now, why would they do that? Is it that difficult to become a nurse? Or is it more of an issue, we think it is, that nursing jobs in desirable areas are so limited? It goes on further to say that some nurses have ended up working as real estate agents, insurance agents, car sales agents, or pursued careers in the BPOs. Well, those things all have something in common much different than being a nurse. They're day shift jobs. Nursing is a 24-hour a day vocation. In other words, there are shifts. In the US, it's not easy to work your way up to a set day shift nursing job. You generally have to rotate nights and weekends. All right. That's one thing. The other thing is that the money. And he goes on to say, we're not paying our new nurses enough to encourage them to practice their profession. And here we go. We're going to take a look at a couple of those issues. According to the Professional Regulation Commission, the Philippines produced a total of 37,000 new nurses in 2024, a slight increase from the 36,525 in 2023. Okay, it went up. That's a good thing, right? But then he pointed out that these numbers were low when 10 years ago, the average of new nurses was 63,000. Now, many of you may not, or many of you do know that the Philippines has exported nurses for decades now. For decades, hospitals actually put together recruiting teams that come to the Philippines, interview, and offer jobs. They set up the visas, they do the transportation, they give them temporary housing to get them started. They do everything they can when the crisis was so critical in the U.S. Well, the crisis in the U.S. is not nearly as critical as it used to be. And that's because the U.S. expanded how it became a nurse. When I first started in medicine, nursing school was a 4-year bachelor's degree program. Now you can get a nursing degree in 2 years in the U.S. or 3, at least 3, if not 2, I believe. So there are some community colleges that have it packed into 2 years. But the point here is that the number of nurses have gone up, but there's still, because of the aging population of the U.S., there's still a shortage, but we're not recruiting as many into the U.S. But it already says, we're looking at almost a 50% drop in the number of nurses being produced in the Philippines. And what are they looking for? Overseas employment. Many of them, a significant number, he says, have already set their sights on overseas employment, which is going to drive that even further. All right. So the WHO is got data, and it says that currently the Philippines is short of 127,000 nurses. That's a lot. And people need to recognize how important the nurse is to the entire healthcare chain of custody. Nurses are the first people to do the assessments. Nurses do a lot of the grunt work, and nurses look out after their patients, especially when you have multiple doctors involved with one patient. Their coordination of care is critical. So they're saying that if it's left unchecked at the current rate, the shortage is going to be 250,000 by 2030. Well, why are they going to do that? What's going on? How do we do, what's causing this? Well, it's pay. It's pay and it's working conditions. Now, they didn't talk about the working conditions, but I can tell you, after recently being in the hospital and seeing the working conditions, it's kind of archaic. But let's talk about pay for a second. They're trying to raise the salary of nurses in the Department of Health and in the public hospital systems. And this is kind of weird. All public hospitals fall under the Department of Health, but not all of them are DOH hospitals, if that makes any sense. I'm not sure it really does, but there's two separate areas. So we're talking about 40,000, and just to give you some really quick idea, all right, they are currently for a entry grade starting salary of a nurse is 40,208. That's 692 US dollars a month. Now they want to raise that, or there's a bill being submitted. Actually, there's several out there that want to raise it up to 70,013 to $1,200. So it's almost doubling it. All right, it's a 74% increase. In the public public hospitals, it's even lower. And this is just a travesty. It really is. These people go to school for 4 years. They put out a ton of effort. What's going to happen? How is it going to impact you? I can tell you what happens. Nurses that don't have experience aren't getting paid as much, and that makes sense. But because the path to gain that experience and pay to match it doesn't take place, they're not going to get there. It's funny. I was in the hospital. I was up here at Clark Medical for a week. All right. I had pneumonia, cardiac cath, had stents put in. I will tell you right now, not a single nurse that took care of me, and they did a fine job, I might add, not a single one of them was over the age of 30. Not a one. Many of them in their mid 20s, if not all of them. It's so hard to tell, how old a Filipina is, all right, or a Filipino. I had several male nurses as well. The archaic system of medical records and what they go through is quite cumbersome. And it takes away from their nursing patient care when they're required to do paperwork and the paperwork is cumbersome. It takes away from their patient care time. If you're going to be in a hospital, the last thing you want them to worry about is, did I get the billing information for this, injection correct? You just want to make sure that injection was correct. So what happens? What do you think is going to happen? Where is it going to go? Were you in the hospital here in the Philippines? Have you ever been treated in a hospital? And I was in a private hospital. All right. Clark Medical is a private hospital, a upper end. It's really, private doesn't necessarily mean better, although Clark is very good. Don't get me wrong. All right. What would it be like otherwise? How do you see this? Where does it go? These are the questions. What are your thoughts? And let us know. Put it in the comments below. Otherwise, I got to go get some blood work done this morning, and then we'll see what's up for the rest of the day. Please do subscribe, hit that thumbs up. We would certainly appreciate it. Have a great day.